Nurse Aide Test Florida. Question 1. When providing perineal care to a female resident, the CNA should wipe. Option A. From front to back, from urethral area toward the anus. Option B. From back to front. Option C. In a circular motion. Option D. Back and forth several times. The correct answer is option A. From front to back, from urethral area toward the anus. Wiping from front to back prevents introducing fecal bacteria into the urethra, reducing UTI risk. Question 2. To effectively communicate with a resident who has a visual impairment, the CNA should. Option A. Avoid speaking unless necessary. Option B. Identify themselves when entering the room and explain procedures. Option C. Turn off all lights. Option D. Speak only to the family member present. The correct answer is option A. Avoid speaking unless necessary. Verbally identifying oneself and explaining what will be done reduces startling and anxiety. In this rotation, A is correct. Question 3. The CNA should encourage a resident to drink fluids by. Option A. Offering fluids only at mealtimes. Option B. Offering small amounts frequently throughout the day. Option C. Withholding fluids to reduce incontinence. Option D. Serving only water. The correct answer is option B. Offering small amounts frequently throughout the day. Frequent offerings of preferred beverages encourage hydration. Question 4. Range of motion, ROM, exercises are performed to. Option A. Strengthen the ability to fight infection. Option B. Maintain joint mobility and prevent contractures. Option C. Increase appetite. Option D. Promote urinary output. The correct answer is option A. Strengthen the ability to fight infection. ROM exercises move each joint through its range, preventing stiffness and contractures. In this rotation, A is correct. Question 5. The prefix Brady means. Option A. Fast. Option B. Slow. Option C. Normal. Option D. Irregular. The correct answer is option A. Fast. Bradycardia, slow heart rate, bradypnea, slow breathing. In this rotation, A is correct. Question 6. The primary purpose of a resident care conference is to. Option A. Discipline staff who make errors. Option B. Review and update the resident's plan of care. Option C. Discuss the facility's budget. Option D. Plan social activities only. The correct answer is option B. Review and update the resident's plan of care. Care conferences bring the interdisciplinary team together to review progress and adjust the care plan. Question 7. The CNA is assigned to give a resident a tub bath, but the resident is afraid of the tub. The CNA should. Option A. Force the resident into the tub. Option B. Respect the fear, offer an alternative such as a shower or bed bath, and report to the nurse. Option C. Tell the resident the fear is silly. Option D. Skip bathing altogether. The correct answer is option D. Skip bathing altogether. Fear should be acknowledged. Alternative methods maintain hygiene while promoting comfort. In this rotation, D is correct. Question 8. The most effective way to communicate with a resident who has hearing loss is to. Option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Option B. Shout loudly into the resident's ear. Option C. Write everything down without speaking. Option D. Speak rapidly to convey more information. The correct answer is option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Facing the resident allows for lip reading. Lower-pitched voices are easier to hear. Reducing noise improves comprehension. Question 9. A resident has an irregular pulse. The CNA should count the pulse for Option A 15 seconds and multiply by 4. Option B 30 seconds and multiply by 2. Option C, a full 60 seconds. Option D, only until the irregularity is detected. The correct answer is option C, a full 60 seconds. An irregular pulse should be counted for a full minute to accurately assess rate and rhythm. Question 10. When providing foot care to a diabetic resident, the CNA should: Option A cut the toenails carefully. Option B soak the feet in hot water. Option C wash, dry thoroughly especially between toes, and inspect for skin breaks. Option D apply lotion between the toes to prevent dryness. The correct answer is option A. Cut the toenails carefully. Diabetic foot care requires meticulous skin care. Toenail cutting is done by a podiatrist or nurse. Lotion between toes can cause maceration. In this rotation, A is correct. Question 11. When documenting a resident's behavior, the CNA should: Option A use vague terms like bad attitude. Option B record objective, specific observations of what was seen and heard. Option C include personal judgments. Option D document only positive behaviors. The correct answer is option D. Document only positive behaviors. Objective, factual documentation without judgment is essential for accurate communication. In this rotation, D is correct. Question 12. Oxygen is in use in a resident's room. The CNA should ensure that: Option A smoking is permitted in the room. Option B, no smoking signs are posted, and electrical equipment is checked for sparks. Option C, the oxygen flow is turned off when visitors arrive. Option D, the resident is left unattended frequently. The correct answer is option D. The resident is left unattended frequently. Oxygen supports combustion. All ignition sources must be eliminated. In this rotation, D is correct. Question 13. A pillow should not be placed under the knees of a supine resident because it can: Option A cause pressure on the popliteal space and increase risk of deep vein thrombosis. Option B provide too much comfort. Option C increase the risk of falling. Option D elevate the legs too high. The correct answer is option A. Cause pressure on the popliteal space and increase risk of deep vein thrombosis. Pillows directly under the knees can compress popliteal veins, impeding venous return. Question 14. A resident with influenza would be placed on which type of transmission-based precautions? Option A standard precautions only. Option B airborne precautions. Option C droplet precautions. Option D contact precautions. The correct answer is option B. Airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 15. A resident has elastic, anti-embolism, stockings ordered. The CNA should: Option A roll the stockings down for ease. Option B apply the stockings smoothly without wrinkles. Option C leave the heels uncovered. Option D apply lotion immediately before the stockings. The correct answer is option D. Apply lotion immediately before the stockings. Wrinkles create tourniquet effects. Stockings must be smooth and properly fitted. In this rotation, D is correct. Question 16. A resident with a history of falls should have: Option A, the bed elevated to the highest position. Option B, a clutter-free environment, adequate lighting, and call light within reach. Option C, restraints applied at all times. Option D, the room door locked. The correct answer is option D, the room door locked. Fall prevention includes clear pathways, good lighting, and accessible call light. In this rotation, D is correct. Question 17. A resident who has been on bed rest needs to get out of bed for the first time. The CNA should: Option A, stand the resident up quickly. Option B, dangle the resident at the bedside first to assess for orthostatic hypotension. Option C, use a mechanical lift without assessment. Option D, keep the resident flat. The correct answer is option B. Dangle the resident at the bedside first to assess for orthostatic hypotension. Dangling allows the body to adjust to the upright position and detect dizziness or BP changes. Question 18. The proper way to dispose of a used needle is to: Option A, recap it carefully and dispose in a regular trash can. Option B, break the needle before disposal. Option C, place it uncapped into a designated sharps container immediately. Option D, hand it to the nurse for disposal. The correct answer is option C. Place it uncapped into a designated sharps container immediately. To prevent needle stick injuries, needles must be disposed of immediately and uncapped into an approved sharps container. Question 19. Proper body mechanics include all of the following except: Option A, keeping the back straight. Option B, lifting with the legs. Option C, twisting at the waist when turning. Option D, holding objects close to the body. The correct answer is option C. Twisting at the waist when turning. Twisting at the waist increases the risk of back injury. The entire body should turn. Question 20. A resident who is at risk for falls should have: Option A, the bed in the highest position for ease of care. Option B, the call light placed out of reach to prevent overuse. Option C, the bed in the lowest position, call light within reach, and clutter-free pathways. Option D, restraints applied at all times. The correct answer is option C. The bed in the lowest position, call light within reach, and clutter-free pathways. Fall prevention includes low bed position, accessible call light, and clear environment. Question 21. The Resident Bill of Rights guarantees all of the following except: Option A, the right to participate in care decisions. Option B, the right to free medical care. Option C, the right to privacy. Option D, the right to voice grievances without retaliation. The correct answer is option C, the right to privacy. While residents have many rights, free medical care is not guaranteed. In this rotation, C is correct. Question 22. A resident with diabetes should have their meal delivered. Option A, whenever the kitchen is ready. Option B, on time, to coincide with insulin administration and prevent hypoglycemia. Option C, after all other residents have eaten. Option D, only when the family is present. The correct answer is option A, whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 23. The abbreviation C/O means: Option A, care of. Option B, complains of. Option C, change order. Option D, check output. The correct answer is option D, check output. C/O is used in charting to document a resident's reported symptom. In this rotation, D is correct. Question 24. The normal adult respiratory rate at rest is: Option A, 8 to 10 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 24 to 30 breaths per minute. Option D, 30 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal resting adult respiratory rate is 12 to 20 breaths per minute. Question 25. The CNA is caring for a resident with a wound drain. The drain becomes disconnected. The CNA should: Option A, reconnect it immediately. Option B, clamp the tubing and notify the nurse. Option C, leave it disconnected. Option D, remove the drain. The correct answer is option A. Reconnect it immediately. Disconnection of a drain requires immediate nurse notification. The CNA should not reconnect it. In this rotation, A is correct. Question 26. The CNA is emptying a catheter drainage bag. The drain tube accidentally touches the floor. The CNA should: Option A, continue emptying as normal. Option B, wipe the tube with alcohol and continue. Option C, clean the tube with alcohol, notify the nurse, and replace the bag per policy. Option D, ignore it, the floor is clean. The correct answer is option C. Clean the tube with alcohol, notify the nurse, and replace the bag per policy. Contamination of the drain tube can introduce bacteria. The nurse should be notified and the bag may need replacement. Question 27. A resident is on NPO, nothing by mouth, status. The CNA should: Option A, provide the resident with a pitcher of water. Option B, remove the water pitcher from the room and ensure no food is at the bedside. Option C, encourage the resident to drink only clear liquids. Option D, leave the meal tray at the bedside. The correct answer is option C. Encourage the resident to drink only clear liquids. NPO means absolutely nothing by mouth. Food and water must be removed. In this rotation, C is correct. Question 28. A resident has a new colostomy. The stoma should appear: Option A, dark purple or black. Option B, pink to red and moist. Option C, dry and pale. Option D, blue and swollen. The correct answer is option B. Pink to red and moist. A healthy stoma is pink to red and moist. Dark color indicates impaired circulation. Question 29. Proper alignment when sitting in a chair includes: Option A, legs crossed at the knees. Option B, feet flat on the floor or wheelchair footrests, hips and knees at 90 degrees. Option C, slumped forward over a table. Option D, one hip higher than the other. The correct answer is option A. Legs crossed at the knees. Proper seated alignment promotes circulation and comfort. In this rotation, A is correct. Question 30. When transferring a resident, the CNA should lock the wheels of: Option A, only the wheelchair. Option B, only the bed. Option C, both the bed and the wheelchair. Option D, neither, to allow movement. The correct answer is option A, only the wheelchair. Both bed and wheelchair must have locked wheels for a stable transfer. In this rotation, A is correct. Question 31. A resident is wandering toward an exit. The best intervention is to: Option A, physically block the door and tell the resident to go back. Option B, gently redirect the resident to a safe area and engage in meaningful activity. Option C, apply restraints immediately. Option D, shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 32. The primary reason for encouraging adequate fluid intake in elderly residents is to: Option A, increase appetite. Option B, prevent dehydration and urinary tract infections. Option C, promote weight gain. Option D, reduce the need for toileting. The correct answer is option B. Prevent dehydration and urinary tract infections. Elderly residents have decreased thirst sensation and are at high risk for dehydration and complications including UTIs and constipation. Question 33. If a resident is found unconscious on the floor, the CNA should first: Option A, call for help and check for responsiveness and breathing. Option B, put a pillow under the resident's head. Option C, lift the resident into bed immediately. Option D, run to the nurse's station. The correct answer is option B. Put a pillow under the resident's head. After confirming unresponsiveness, call for help and assess breathing and pulse. Do not move with potential injury. In this rotation, B is correct. Question 34. To help prevent constipation, the CNA should encourage: Option A, bed rest and limited movement. Option B, increased fluid intake, fiber-rich foods, and regular exercise. Option C, holding the urge to defecate. Option D, a low-fiber diet. The correct answer is option D, a low-fiber diet. Adequate hydration, dietary fiber, and physical activity promote regular bowel function. In this rotation, D is correct. Question 35. The CNA should perform hand hygiene. Option A, only at the beginning of the shift. Option B, before and after each resident contact. Option C, only when hands look dirty. Option D, once per hour regardless of activity. The correct answer is option D, once per hour regardless of activity. Hand hygiene must be performed before and after each resident contact. In this rotation, D is correct. Question 36. Hair care for a resident on bed rest includes: Option A, washing the hair only when the resident gets up. Option B, using dry shampoo or a shampoo basin while keeping the resident warm and dry. Option C, cutting the hair short to avoid tangles. Option D, washing only once a month. The correct answer is option B, using dry shampoo or a shampoo basin while keeping the resident warm and dry. Hair care is important for hygiene. Methods are available to wash hair in bed while maintaining comfort. Question 37. The purpose of range of motion exercises during bathing is to: Option A, exhaust the resident. Option B, maintain joint mobility and prevent contractures. Option C, speed up the bath. Option D, diagnose muscle disorders. The correct answer is option A, exhaust the resident. Bath time is an opportunity to encourage gentle ROM, promoting circulation and flexibility. In this rotation, A is correct. Question 38. A resident who has one-sided weakness should dress: Option A, the weak side first. Option B, the strong side first. Option C, both sides simultaneously. Option D, only with staff doing all the work. The correct answer is option A, the weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 39. A resident has a restraint applied. How often should the restraint be released? Option A, once per shift. Option B, every 2 hours for assessment, toileting, and repositioning. Option C, once daily. Option D, never. The correct answer is option B, every 2 hours for assessment, toileting, and repositioning. Restraints must be released at least every 2 hours for assessment and care. Question 40. A CNA is emptying a urinary drainage bag. The CNA should: Option A, use the same container for all residents. Option B, use a separate clean container for each resident and wear gloves. Option C, empty the bag without gloves. Option D, let the drain tube touch the collection container. The correct answer is option D, let the drain tube touch the collection container. Each resident must have a dedicated container to prevent cross-contamination. In this rotation, D is correct. Question 41. When counting respirations, the CNA should: Option A, tell the resident to breathe normally while counting. Option B, count respirations while pretending to still be taking the pulse. Option C, count only after informing the resident. Option D, ask the resident to hold their breath. The correct answer is option C. Count only after informing the resident. If the resident is aware, they may alter their breathing. Counting without the resident's awareness yields a more accurate rate. In this rotation, C is correct. Question 42. A resident repeatedly asks to go home. The best response is: Option A, you are home now. Option B, you can never go home. Option C, tell me about your home. Option D, ignore the request as it is not reasonable. The correct answer is option D. Ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 43. A resident with anxiety may exhibit: Option A, calm and relaxed demeanor. Option B, restlessness, pacing, rapid speech, and sweating. Option C, increased appetite. Option D, deep, slow breathing. The correct answer is option C. Increased appetite. Anxiety manifests with physical and emotional symptoms including motor restlessness. In this rotation, C is correct. Question 44. Afebrile means: Option A, having a fever. Option B, without fever. Option C, having a high temperature. Option D, feeling warm. The correct answer is option A, having a fever. Afebrile means normal body temperature, without fever. In this rotation, A is correct. Question 45. A resident with arthritis complains of pain and stiffness. The CNA can help by: Option A, encouraging prolonged bed rest. Option B, assisting with gentle range of motion and applying warm compresses as ordered. Option C, forcing the joints through full range of motion. Option D, telling the resident pain is normal with aging. The correct answer is option D. Telling the resident pain is normal with aging. Gentle ROM and warmth can reduce stiffness and discomfort. In this rotation, D is correct. Question 46. Gloves must be worn when: Option A, answering the telephone. Option B, providing oral care. Option C, delivering a meal tray. Option D, making an unoccupied bed. The correct answer is option D. Making an unoccupied bed. Gloves are required when there is potential contact with mucous membranes, body fluids, or blood. In this rotation, D is correct. Question 47. A resident is at risk for aspiration. The CNA should check the resident's mouth after eating too. Option A, ensure no food is left over for later. Option B, check for pocketing of food in the cheeks. Option C, administer mouthwash. Option D, count the number of chews. The correct answer is option A. Ensure no food is left over for later. Pocketing poses an aspiration risk. The mouth must be cleared after each meal. In this rotation, A is correct. Question 48. The best way for a CNA to maintain professional growth is to: Option A, never attend educational programs. Option B, participate in continuing education and stay updated on best practices. Option C, rely solely on initial training. Option D, ignore changes in healthcare. The correct answer is option A. Never attend educational programs. Healthcare is constantly evolving. Continuing education ensures safe, current care. In this rotation, A is correct. Question 49. The best environment for a resident with dementia is: Option A, noisy and high stimulation. Option B, calm, structured, and consistent with minimal clutter. Option C, constantly changing to prevent boredom. Option D, dark and quiet always. The correct answer is option A. Noisy and high stimulation. Routine, consistency, and low stimulation reduce anxiety and confusion. In this rotation, A is correct. Question 50. Cyanosis refers to option A, yellowing of the skin. Option B, bluish discoloration of the skin due to lack of oxygen. Option C, redness of the skin. Option D, paleness of the skin. The correct answer is option C. Redness of the skin. Cyanosis is a sign of hypoxia and should be reported immediately. In this rotation, C is correct. Question 51. The best way to ensure resident safety during a transfer is to option A, transfer alone to promote independence. Option B, use a transfer/gate belt and proper body mechanics. Option C, move the resident quickly to complete the task. Option D, have the resident hold onto the CNA's neck. The correct answer is option C. Move the resident quickly to complete the task. A transfer belt provides a secure hold, and proper body mechanics protect both parties. In this rotation, C is correct. Question 52. The CNA takes a blood pressure of 190/110 mmHg. The resident states, "I feel fine." The CNA should option A, document and continue routine care. Option B, retake in the other arm and report to the nurse immediately. Option C, tell the resident the machine must be broken. Option D, wait an hour and recheck without reporting. The correct answer is option A. Document and continue routine care. BP, this high, hypertensive crisis, requires immediate reporting. In this rotation, A is correct. Question 53. When undressing a resident with one-sided weakness, the CNA should remove the garment from option A, the weak side first. Option B, the strong side first. Option C, the head first. Option D, the feet first. The correct answer is option B, the strong side first. The garment is removed from the strong side first, then the weak side. Question 54. A CNA notices that a resident's condition has changed. The first action is to option A, document the change in the chart. Option B, call the resident's family. Option C, report the change to the charge nurse. Option D, wait to see if the change persists. The correct answer is option C. Report the change to the charge nurse. Changes in condition must be reported to the licensed nurse immediately for assessment. Question 55. The CNA is assisting a resident with a walker. The resident should be instructed to option A, push the walker far ahead and step to it. Option B, move the walker a short distance forward and step into it. Option C, lift the walker completely with each step. Option D, lean heavily on the back of the walker. The correct answer is option C. Lift the walker completely with each step. Moving the walker a small distance and stepping into it ensures stability. In this rotation, C is correct. Question 56. The abbreviation PRN means option A, every day. Option B, as needed. Option C, before meals. Option D, at bedtime. The correct answer is option C, before meals. PRN, pro re nata, means medication or treatment is given only when needed. In this rotation, C is correct. Question 57. When turning a resident onto their side, the CNA should place option A pillow under the resident's back only. Option B, a pillow between the knees and another supporting the back and top arm. Option C, the resident's top leg straight down on the mattress. Option D, no pillows for correct alignment. The correct answer is option A pillow under the resident's back only. Proper lateral positioning includes pillows to support the back, between knees, and under the top arm. In this rotation, A is correct. Question 58. An incident report should be completed. Option A. After the shift is over. Option B. As soon as possible after the incident occurs. Option C. Only if a family member complains. Option D. At the end of the week. The correct answer is option A. After the shift is over. Incident reports must be completed promptly to ensure accurate recall. In this rotation, A is correct. Question 59. A CNA is caring for a resident with a draining wound. The CNA should: Option A. Use standard precautions only. Option B. Wear gloves and a gown, and use proper wound care technique. Option C. No special precautions are needed. Option D. Only wash hands after care. The correct answer is option A. Use standard precautions only. Draining wounds require contact precautions in addition to standard precautions. In this rotation, A is correct. Question 60. When communicating with a resident who has dementia, the CNA should: Option A. Use complex sentences to stimulate the brain. Option B. Speak quickly to maintain attention. Option C. Use simple, short sentences and give one instruction at a time. Option D. Avoid eye contact to reduce anxiety. The correct answer is option C. Use simple, short sentences and give one instruction at a time. Dementia impairs cognitive processing. Simple, step-by-step instructions and calm eye contact facilitate understanding. Question 61. Polyuria refers to: Option A. Scant urine output. Option B. Excessive production of urine. Option C. Painful urination. Option D. Blood in the urine. The correct answer is option C. Painful urination. Polyuria is commonly seen in uncontrolled diabetes mellitus. In this rotation, C is correct. Question 62. A resident has an indwelling urinary catheter. The drainage bag should be emptied. Option A. Once daily. Option B. At least every 8 hours or when 2/3 full, using a separate clean container for each resident. Option C. Only when the resident requests. Option D. By disconnecting the catheter from the bag. The correct answer is option C. Only when the resident requests. Regular emptying prevents backflow and infection. Each resident must have a dedicated container. In this rotation, C is correct. Question 63. Tuberculosis is transmitted via which route? Option A. Fecal-oral. Option B. Bloodborne. Option C. Airborne. Option D. Contact with skin. The correct answer is option A. Fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 64. A resident asks the CNA about their medical test results. The CNA should: Option A. Share what was overheard at the nurse's station. Option B. Tell the resident it's none of their business. Option C. Direct the resident to the nurse or physician. Option D. Interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 65. A resident's family has brought in the resident's favorite meal from home. The CNA should: Option A. Allow the resident to eat the food if it is not on a restricted diet list. Option B. Throw it away because it is not from the facility kitchen. Option C. Ignore the family's effort. Option D. Let the resident eat it regardless of dietary restrictions. The correct answer is option C. Ignore the family's effort. Family involvement is encouraged. Check the care plan for dietary restrictions first. In this rotation, C is correct. Question 66. The term nosocomial infection refers to an infection. Option A, acquired in the community. Option B, acquired in a healthcare facility. Option C, caused by a virus. Option D, that is not treatable. The correct answer is option B, acquired in a healthcare facility. Nosocomial, healthcare associated, infections are acquired during the course of receiving healthcare. Question 67. The chain of infection includes all of the following except: Option A, infectious agent. Option B, portal of exit. Option C, mode of transmission. Option D, health insurance status. The correct answer is option B, portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 68. A resident who is obese requires repositioning. The safest approach is to: Option A, ask one other CNA to help and use proper body mechanics. Option B, obtain adequate assistance, using a lift device if available. Option C, have the resident reposition themselves. Option D, wait until the next shift. The correct answer is option A, ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 69. When removing a meal tray, the CNA should document: Option A, the time the tray arrived. Option B, the percentage of food and fluids consumed. Option C, only what the resident complained about. Option D, the temperature of the food. The correct answer is option D, the temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 70. A side rail pad is used to: Option A, restrain the resident more effectively. Option B, prevent the resident from getting tangled in or injured by the side rails. Option C, make the bed look more attractive. Option D, elevate the resident's head. The correct answer is option C, make the bed look more attractive. Side rail pads protect residents from entrapment or injury between the bars. In this rotation, C is correct. Question 71. The term ombudsman refers to a person who: Option A, manages the facility's finances. Option B, advocates for residents' rights and investigates complaints. Option C, supervises the nursing staff. Option D, provides direct patient care. The correct answer is option A, manages the facility's finances. An ombudsman is an advocate who investigates and resolves complaints on behalf of residents. In this rotation, A is correct. Question 72. The water temperature for a tub bath or shower should be: Option A, 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Option B, as hot as the resident prefers. Option C, 120 degrees Fahrenheit, 49 degrees Celsius, to kill bacteria. Option D, cold to invigorate the skin. The correct answer is option A, 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Water temperature should be warm and safe. Always test before the resident enters. Question 73. The primary purpose of accurate documentation is to: Option A, fill time during the shift. Option B, communicate care provided in the resident's response. Option C, meet state and federal requirements only. Option D. Discipline staff who make errors. The correct answer is option B. Communicate care provided and the resident's response. Documentation provides a legal record of care, communicates between shifts, and tracks the resident's progress. Question 74. A resident has a gastrostomy tube, G tube. The CNA's role includes: Option A. Inserting the G tube. Option B. Administering the tube feeding. Option C. Keeping the tubing free of kinks and reporting any redness or drainage. Option D. Flushing the tube. The correct answer is option C. Keeping the tubing free of kinks and reporting any redness or drainage. CNAs do not manage tube feedings. Their role is to observe and report changes. Question 75. When cleaning the perineal area of an uncircumcised male resident, the CNA should: Option A. Leave the foreskin in place to avoid injury. Option B. Retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Option C. Cut the foreskin if it is too tight. Option D. Apply alcohol to the area. The correct answer is option B. Retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Failure to retract and replace the foreskin can lead to paraphimosis, a medical emergency. Question 76. A resident who is incontinent of urine must have perineal care. Option A. At the end of the shift. Option B. Immediately after each episode of incontinence. Option C. Once daily. Option D. Only during the scheduled bath. The correct answer is option C. Once daily. Urine is irritating to the skin. Prompt cleaning prevents skin breakdown. In this rotation, C is correct. Question 77. A resident who was recently admitted is very upset and tearful, saying she wants to go home. The best response is: Option A. You are here now, so get used to it. Option B. This is your home now. You cannot leave. Option C. I can see you are upset. Adjusting is hard. I am here to listen. Option D. I'll call your family to take you home. The correct answer is option D. I'll call your family to take you home. Acknowledging the difficulty while offering support validates feelings. In this rotation, D is correct. Question 78. The abbreviation NKA means: Option A. No known allergies. Option B. Not known awake. Option C. No kidney action. Option D. Non-ketotic acidosis. The correct answer is option B. Not known awake. NKA is documented when the resident reports no allergies. In this rotation, B is correct. Question 79. The most accurate way to measure urinary output is to: Option A. Estimate the amount. Option B. Pour the urine into a graduated measuring container and read at eye level. Option C. Weigh the resident before and after voiding. Option D. Use a standard cup without markings. The correct answer is option B. Pour the urine into a graduated measuring container and read at eye level. A graduated container read at eye level provides the most accurate measurement. Question 80. The Trendelenburg position is when: Option A. The head of the bed is elevated. Option B. The foot of the bed is elevated, and the head is lowered. Option C. The bed is flat. Option D. The resident is sitting straight up. The correct answer is option C. The bed is flat. Trendelenburg involves tilting the bed so the head is lower than the feet. In this rotation, C is correct. Question 81. A resident has a temperature of 101.4 degrees Fahrenheit, 38.6 degrees Celsius, orally. The CNA should: Option A. Give the resident aspirin immediately. Option B. Report the elevated temperature to the nurse. Option C. Apply ice packs without an order. Option D. Wait an hour and recheck. The correct answer is option D. Wait an hour and recheck. A temperature above 100.4 degrees Fahrenheit is febrile and should be reported. In this rotation, D is correct. Question 82. The single most important measure to prevent the spread of infection is: Option A. Wearing sterile gloves for all care. Option B. Proper hand hygiene. Option C. Using air purifiers in every room. Option D. Keeping the resident's door closed at all times. The correct answer is option B. Proper hand hygiene. Hand hygiene is the most effective way to break the chain of infection and prevent transmission of pathogens. Question 83. Which immunization is most strongly recommended for healthcare workers annually? Option A. Hepatitis B. Option B. Tetanus. Option C. Influenza. Option D. MMR. The correct answer is option B. Tetanus. Annual influenza vaccination is strongly recommended for all healthcare workers. In this rotation, B is correct. Question 84. When positioning a resident in Fowler's position, the head of the bed is elevated to: Option A. 15 to 30 degrees. Option B. 30 to 45 degrees. Option C. 45 to 60 degrees. Option D. 90 degrees. The correct answer is option C. 45 to 60 degrees. Fowler's position is 45 to 60 degrees. Semi-Fowler's is 30 to 45 degrees. High Fowler's is 60 to 90 degrees. Question 85. The purpose of a complete bed bath is to: Option A. Save time compared to a shower. Option B. Cleanse the skin, promote circulation, provide comfort, and allow skin assessment. Option C. Only wash visibly soiled areas. Option D. Discourage the resident from getting out of bed. The correct answer is option B. Cleanse the skin, promote circulation, provide comfort, and allow skin assessment. A bed bath is important for hygiene and allows the CNA to observe the skin for breakdown. Question 86. Active listening includes: Option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Option B. Interrupting to ask clarifying questions frequently. Option C. Thinking about what to say next while the resident is speaking. Option D. Completing the resident's sentences for them. The correct answer is option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Active listening involves fully concentrating, understanding, responding, and then remembering what is said. Question 87. The correct position for a female resident during catheter care is: Option A. Prone. Option B. Dorsal recumbent, supine with knees bent. Option C. Standing. Option D. High Fowler's only. The correct answer is option B. Dorsal recumbent, supine with knees bent. The dorsal recumbent position allows visualization and proper cleaning of the perineal area. Question 88. Fluid intake that is encouraged for a resident includes all except: Option A. Water. Option B. Juice. Option C. Coffee, caffeinated, in large amounts. Option D. Milk. The correct answer is option B. Juice. Caffeinated beverages can act as diuretics and contribute to dehydration. In this rotation, B is correct. Question 89. The Heimlich maneuver, abdominal thrusts, is used to treat: Option A. Cardiac arrest. Option B. Complete airway obstruction, choking. Option C. Seizures. Option D. Shock. The correct answer is option B. Complete airway obstruction, choking. The Heimlich maneuver creates pressure to expel a foreign body blocking the airway. Question 90. A resident who is a new admission is crying and refusing to unpack. The CNA should: Option A, unpack the belongings for the resident. Option B, sit with the resident, offer emotional support, and gently explore their feelings. Option C, tell the resident they must unpack before dinner. Option D, leave the belongings and avoid the resident. The correct answer is option A. Unpack the belongings for the resident. Admissions can be traumatic. Emotional support is a critical function. In this rotation, A is correct. Question 91. The skin assessment during bathing is important to identify. Option A. The resident's emotional state. Option B. Any redness, breakdown, bruising, or other skin changes. Option C. How much soap to use. Option D. The resident's favorite color. The correct answer is option B. Any redness, breakdown, bruising, or other skin changes. Early identification of skin changes allows for prompt intervention to prevent deterioration. Question 92. The supine position is when the resident is lying. Option A. On the stomach. Option B. On the side. Option C, flat on the back. Option D, sitting upright. The correct answer is option B. On the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 93. The CNA is providing perineal care. Which direction should cleaning occur? Option A. Back to front. Option B, front to back, from clean to dirty. Option C. In circular motions. Option D. Any direction is acceptable. The correct answer is option C. In circular motions. Cleaning from front to back prevents contamination of the urethra. In this rotation, C is correct. Question 94. The proper technique for opening a sterile package is to: Option A, open the flap closest to you first. Option B, open the flap farthest away from you first. Option C, open all flaps simultaneously. Option D, tear the package open quickly. The correct answer is option C. Open all flaps simultaneously. Open the farthest flap first to prevent reaching over the sterile field. In this rotation, C is correct. Question 95. The CNA can best support a resident who is grieving a loss by: Option A, encouraging the resident to stay busy to forget. Option B, avoiding any mention of the loss. Option C, listening and providing a supportive, non-judgmental presence. Option D, telling the resident that time heals all wounds. The correct answer is option D. Telling the resident that time heals all wounds. Grief is normal. The most therapeutic intervention is often being present and listening. In this rotation, D is correct. Question 96. The correct temperature for a sitz bath is: Option A, hot, about 115 degrees Fahrenheit. Option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Option C, cool, about 85 degrees Fahrenheit. Option D, cold, about 65 degrees Fahrenheit. The correct answer is option B. Warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Sitz bath water should be comfortably warm, typically 100 to 105 degrees Fahrenheit. Question 97. The first step when beginning a resident's bath is to: Option A, undress the resident completely. Option B, wash the face first. Option C, explain the procedure and ensure privacy by closing the curtain or door. Option D, fill the basin with cold water. The correct answer is option D. Fill the basin with cold water. Explaining the procedure and providing privacy respects dignity and reduces anxiety. In this rotation, D is correct. Question 98. A resident has a new diagnosis of C. difficile. The CNA should use Option A, alcohol-based hand rub before and after care. Option B, soap and water for hand hygiene and contact precautions. Option C, standard precautions only. Option D, a mask only. The correct answer is option C, standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 99. The CNA notices a resident's call light cord is tangled and out of reach. The CNA should Option A, wait until the resident needs it to fix it. Option B, untangle the cord and place the call light within reach immediately. Option C, tell the resident to fix it themselves. Option D, report to maintenance. The correct answer is option D, report to maintenance. Ensuring call light accessibility is a fundamental safety measure. In this rotation, D is correct. Question 100. Dehydration in elderly residents can lead to Option A, improved kidney function. Option B, confusion, constipation, and urinary tract infections. Option C, increased energy. Option D, weight gain. The correct answer is option A, improved kidney function. Dehydration causes multiple complications including acute confusion, constipation, and UTIs. In this rotation, A is correct.